So with your inguinal hernia repair, as with any surgery, there are potential risks of surgery that are particular to the inguinal hernia itself. The inguinal hernia operation is done down low in the groin, and all of the swelling here is going to go straight down to the penis and the scrotum. For women, it'll go down to the vulva. So all of the swelling here is expected to go downhill, and you have a hard time getting it up and out of there. For men, a scrotal support is advised for 2 or 3 weeks, particularly at night when gravity is on your side, to get that swelling out of there. If there's any bruising, typically shows up 3 to 4 days later. The penis and the scrotum will turn purple. It'll go away, but it's not an indication of new bleeding. It's just took it a little while to get down there where the skin is thinner. So you want to keep ice on for the first 24 to 48 hours to minimize that swelling and minimize the bruising. You want to avoid aspirin before surgery to minimize the bruising, unless you're specifically told to stay on the aspirin. Hernia repairs can break down, and recurrence rate is about 2% after a mesh repair of an inguinal hernia. Avoid heavy lifting, keep your balance, don't be doing any falls to minimize the risk of recurrence. A recurrent hernia is a more risky operation in terms of recovery and injury to other structures in the area. The other structure in the area is the blood vessels to the testicle. Men have the inguinal hernia because the blood vessels to the testicle come through the muscles. That leaves a weak area that gets bigger. When we repair the hernia, we're going to push the guts back in, close that hole down, and tighten it up around there with some mesh. If there's too much swelling there, that will cause testicle pain from lack of blood supply. And that's how you turn little sheep into non-productive sheep, as they band the testicles. And that generally is very painful. So after the operation, within the first 3 or 4 days, if you're having more and more and more testicle pain, I need to know about that. That's not something the emergency room docs don't necessarily know what to do with. I need to know about that. That takes some special tests. I've had 2 patients in 25 years that have reoperated on and opened those blood vessels up back and probably saved their testicle. And I had 2 patients that toughed it out and they lost their testicle. And one of them didn't even tough it out. He went to the emergency room. The guy in the emergency room gave him more pain pills. He didn't bother to tell him that his testicle was hurting. And that is one of the major things to protect yourself with, is to be aware that more and more and more testicle pain up front is potentially threatening your testicle. Let's be talking about that early. The other thing that's in the area there is a nerve. There are 3 nerves that run through this area. One of them is typically in the course of the operation, but it's also there because the hernia is pushing on that nerve. That nerve is responsible for a lot of the pain that people have. If that nerve is left in place as a damaged nerve, 11% of people can end up with chronic pain in the groin area despite the fact that their hernia is repaired. And it can be disabling pain. With hernia repairs being one of the more common operations in the world, there's a lot of men every year that are disabled as their hernia repairs. So it's my practice, and this is what's been done to me also. I've had hernia repairs on both sides. And I've had that nerve taken out, and I generally will take the nerve out unless somebody really wants that nerve to be remaining, because even without mesh, if that nerve gets bound down in the scarring process, 11% of people are going to end up with chronic pain. If we take that section of nerve out, only 3% of people will end up with chronic pain. They'll end up with numbness, but I would rather have patients with numbness than patients with chronic pain any day of the week. And you would rather have that as well. So if you have an aversion to having a nerve taken out, let's talk about it and the rationale a little bit more. But my research is clearly demonstrating that these are nerves that are permanently damaged by the time the hernia is being repaired in patients who have hernia pain. That nerve is purely sensory. It's all in the groin here. It is not going to affect balance, strength, sexual function, bowel or bladder function. None of those nerves are involved with this simple superficial nerve here that we're talking about. The other possibility is the intestines getting injured. That bulge that you have down there in the groin is your intestines hanging out, and it's this far under the surface. maybe even less. And if you cough or sneeze or tell a joke in the middle of the operation and your guts pop out, well, I got sharp instruments down there, that can result in a poopy mess. And that's part of why in America, most hernia repairs are done with you asleep. If you had your hernia repaired today in Cuba or Sweden or Denmark, where they have socialized medicine, they prescribe that the hernia repairs are always done under local anesthetic, sit still and behave. But I've never had a patient with a bowel injury associated with inguinal hernia repair, and that's partly because I generally in my practice have patients asleep for the operation to make it safer and certainly make your experience a little smoother as well.